So the Republicans have a real problem. They are trying to cut $880 billion out of Medicaid, and there is not enough waste, fraud, and abuse to cut $880 billion from Medicaid, not even close. And so they are coming after people's health care, pure and simple. And they'll find many ways to talk about this. They'll talk about work requirements. But let's be clear what they're talking about. They're really talking about work reporting requirements. We have already seen this experiment in Georgia. Our governor has a program called Pathways to Coverage. He ought to call it Roadblocks to Coverage. We've got over 500,000 people in Georgia who are in the health care coverage gap. A lot of those folks could be covered right now if Georgia would just accept the Medicaid expansion. Instead, we've seen this program, and 20 months later, they've covered a whopping 7,000 people. That's it. 7,000 people. And so all of these are just tricks. These efforts of putting red tape up, asking people to certify their hours month after month after month, does not incentivize work, but it does a very good job of keeping working people off of their health care. And as a result of that, our workforce grows sicker and poorer, and it's a drag on our economy. Every time I hear this, I think about Heather Payne, who is a traveling nurse in Georgia. And ironically, she spent her whole career working in healthcare. And one day she got sick. And to make a long story short, she discovered she had had a series of mini strokes. And she needed to see a neurologist, but she didn't have health care. And so all of this time later, she's struggling, trying to get her life back together. Heather Payne, traveling nurse from Georgia, doesn't need work requirements. She needs health care so that she can get back to work. The data is very clear on this. I released a report on this last week. I want to see people work. My daddy drilled that into me. And so we're not going to let people moralize and preach to us about work requirements while they're giving billionaires a tax cut. The way to get people back to work is to have a healthy workforce. And so we all must raise our voices on this budget. A budget is not just a fiscal document, it's a moral document. Show me your budget and I'll show you who you think matters and who does not. And if this budget that they're trying to push through using reconciliation were an EKG, it would suggest that the Republican Party has a heart problem and that they are in need of moral repair. And so we will continue to raise the voices of ordinary people and stand on the side of the people who sent us here so that they can get back to work and do the best by their families.
Thank you, Senator Warnock.